According to the minority MPs on the Health Committee, government has directed colleges of health not to admit more than 50% of its admission capacity.
We, the minority in Parliament, are deeply concerned about the Ministry of Health's recent policy and administrative directive to heads of nursing training colleges, which has resulted in the Council of Health Training Institutions ordering an immediate and infinite suspension of admissions into their colleges. Per information reaching us, part of these new administrative directives require nursing training institutions to reserve a minimum of 30% of their total admissions for the Ministry of Health to complete. Per official communications from the Ministry of Health to nursing training colleges, colleges are now restricted to admit not more than 50% of their capacities.
The minority say this latest directive will cripple the training of nurses in the country. According to the Juabosu MP, Kwabena Minta Kando, who is the ranking member on the committee, the latest directive should not stand.
We see these new directives as an attempt by government to clear a path that makes room for protocol admissions of party apparatchiks, candidates with deep pockets, and those who, under normal circumstances, will not gain admissions to get access to these training colleges. This, we believe, is a recipe for the unbridled corruption that has recently characterized all admissions into government institutions, be it the police service, military recruitment, teacher training schools, and now nursing training colleges. Certainly, this must not be allowed to continue. Underlying this restrictive admission directive is government's inability to back its manifesto promise with the financial commitment required. These restrictions on intake into nursing training colleges smacks of policy incoherence and pure insensitivity.
The Ghana Nurses and Registered Midwives Association this year revealed that 3,000 nurses have left the country just this year alone for greener pastures elsewhere. The minority are questioning why, on the back of this, government will seek to limit the number of nurses that are trained in Ghana. They've also been questioning why government will be implementing free senior high school, which will lead to a number of students coming out of schools and willing to enter tertiary institutions, and at the same time seeking to thwart their efforts to enter tertiary institutions. They said this policy is not good and must be withdrawn immediately. The minority will also in the coming days probably be outlining some kind of measures they will be taking in the case government fails to heed to these demands of theirs. They've been saying that some principals of these colleges of health are afraid that if they come out and speak, they will be victimized. And that is why they, as the minority, are seeking to keep government on their toes on this promise. The minority wants the following measures to be taken.
The minority in Parliament therefore calls on government to, as a matter of urgency, reverse its policy directive on reserving 30% of admissions into nursing training colleges for the Ministry of Health, and that without delay, so that the admissions process can continue.
Government is yet to respond to these latest allegations from the minority, who are still insisting this matter should be addressed immediately before public colleges of health collapse. For Joy News, Kweku Asante,